conducted day before yesterday one webinar on vector-borne diseases or fevers. Today, we are creating awareness on, not celebrating, World Mosquito Day. We would like to welcome you all on behalf of Independent Research Ethics Society, AYUSH Samriddhi International Webinar Series at milestone of 2634. Thank you. I'm confident that it's world's longest and fastest series of webinars. In recent 365 days, we have conducted 905 webinars, 15 webinars, and 26 webinars within 1938 days. So thank you. Thank you very much for joining. Your active participation, cooperation has inspired us to achieve this milestone. Tomorrow we will be conducting on gynecology, and today we are conducting webinar on dengue and malaria, prevent and cure. So I would like to welcome Dr. Rekha Pattar, Assistant Professor, Department of Kumar, Sri Paripurna Sanatana Ayurveda Medical College, Hospital and Research Center, Bengaluru. Welcome, Dr. Rekha. I would like to welcome Dr. Tejendra Singh, Assistant Professor, Department of Swasthya, Krishna Ayurveda Medical College, Hospital, Bijnor. I will be welcoming Dr. Suparna S. Mukherjee, Madam, Associate Professor and HOD, Department of Education, School of Humanity, CCOM Skills University, and I am welcoming Dr. Sakat Kumar Basu, Executive Research Director, Performance Seed Lethbridge, Alberta, Canada and West Bengal. Thank you. Thank you very much, all the speakers. Again, I would like to welcome all of you and would like to start the webinar with Dr. Rekha. Dr. Rekha, welcome. Please communicate my thanks and regards to Dr. Swagat also.
Sure, sir. Thank you, sir. So, very good evening to everyone. Myself, Dr. Rekha. So, first of all, I would
You
like
can
to.
go for slideshow to maximize the size.
Yes.
Yes, great.
Yeah. My slides are visible?
Yes, yes.
Yeah. So,
Perfect.
Today I'll be presenting on prevention and cure of dengue and malaria, the main two very commonly affected vector-borne diseases. So why we need to study these two diseases is because it is becoming a very burning issue, especially in tropical and subtropical areas like India and other countries. It is being said that according to WHO, around 390 million cases per year are registering every year, and if it is not given the proper diagnosis as well as the proper treatment, then it can even lead into the fatal also. So it is very important to study. So let me start my the presentation with the introduction. I'll start with my presentation with the dengue fever first. So, dengue is a seasonal vector-borne viral fever which is mainly seen in tropical and subtropical region. It is a non-specific febrile illness, can even reach up to the fatal hemorrhagic disease also. So, this particular infection, which is mainly caused by a virus called as a dengue virus, which has mainly four serotypes, that is dengue virus 1, 2, 3, and 4, and it is mainly spread by a vector called the mosquito Aedes aegypti mosquito. So due to its signs and symptoms, even this particular dengue fever is also known as breakbone fever. So as I belongs to a pediatric branch, I need to tell you regarding why dengue in children, why we need to study. As we all know that the dengue can affect all the age group, but then the highest incidences of dengue fever is mainly seen in pediatric age group, that too in between mainly 55 to 15 years of age group. So, according to the World Health Organization, that estimated that maybe 50 million cases of dengue infection worldwide every year, and which is endemic in India. A typical manifestation of are becoming very common in dengue, due to which it is very highest need that we have to diagnose the disease at a particular stage and a particular the clinical stage, and give the proper treatment in order to prevent the fatal stage, or in order to prevent its complications. So atypical manifestations are becoming very common in dengue, especially in pediatric age group, which can delay the diagnosis. So careful observation from the clinician side is very required in order to prevent any serious morbidity as well as mortality. So, how this dengue fever is explained in Ayurveda? So, the references about the dengue fever in Ayurveda I would like to tell here. So, dengue fever can be correlated with Dandakajwara or the Vishamajwara, we could say. This fever is marked by, that is Dandakajwara, which is mainly marked by an intense joint and muscle pain. Hence, it is associated with a breakbone fever, or commonly known as a dengue. And this particular fever or Dandakajwara is mainly explained in Madhava Nidhana, one among the Lagutrayis of Samhita. So, where it is linked to mosquito borne fever with the severe symptomatic symptoms. So, the doshas which are involved in this particular jwara is mainly the Vata and Pitta doshas are vitiated in this particular Dandaka jwara. Why Vata is because of this imbalanced Vata dosha, there will be the joint pain, along with that the body ache and the restlessness is seen. As there is an imbalance of the Pitta dosha, because of which there is high fever, burning sensation, and rashes are also seen. So dhatus, which is mainly involved in this particular disease, is Rakta dhatu, which is promptly affecting the affected and leading into the hemorrhagic tendencies and the skin manifestations in this particular disease. So when we see the symptoms according to the Madhava Nidana, it is Angamarda, which is nothing but the body ache, Sandhi Shula, which is nothing but the joint pain, Jwara, Aruchi is nothing but the loss of appetite, Utklesha, Raktadushti, Shofa, that is rashes, and Netrashula, which is nothing but the eye pain. So when we see the allopathic explanation regarding the dengue fever, especially in the first phase of the symptoms, whatever are the symptoms which has been quoted by our acharyas, the same thing are even explained in the modern sciences also. So by looking at the signs and symptoms, the mode of manifestations, by looking at all these symptoms and criterias, we could correlate the dengue fever with Dandakajwara or Vishamajwara. Let me explain you regarding the epidemiology. That is, the mortality rate is 2 to 8% without the appropriate treatment, less than 1% with adequate treatment. That is why it can be prevented if it is diagnosed properly and given appropriate treatment, proper treatment in a proper time. So infected, it infects the 50 to 100 million people in a million people worldwide a year, leading into half a million hospitalization and approximately 12,500 to 25,000 death. So let us see the causative factors for the dengue fever. As I already told that it is mainly caused by a virus of stereotype 1, 2, 3, and 4 of dengue virus. So it is a single strand positive sense RNA virus which is belonging into Flaviviridae family. The virus has four different types. Among
ये
them,
बाहर रख
one
दिया है
type
कि
will
गमला
among them, one type will give us the lifelong immunity, but no, only the short term immunity to others. It is nothing but, see, in stereotype 1, 2, 3, and 4, if a person get affected with stereotype 1, then the person will get the lifelong immunity for that stereotype 1 of dengue fever itself. But he will get the short term immunity for the stereotype 2, 3, and 4. So the vector, as I already told you, it is Aedes aegypti female D. vital mosquito. The incubation period for this disease is 6 to 7 days. So let's see how exactly it transmit. That is mode of transmission of dengue virus. The dengue is not a communicable disease. Okay, it doesn't spread from person to person, but it can spread only through the bite of affected mosquito. This mosquito is a daytime feeder and prefer to bite early in the morning and evening before dusk. It breeds in a stagnant water, particularly the stagnant water which is more than 1 week. So yeah, this is how it exactly the transmit. First, if a mosquito bites an infected person, it takes that the viruses which will go into the asexual development into the virus. After completion of the asexual development of a virus into the mosquito, it again bites on a normal person. Okay, and then it affects the that particular person. So then let us see the factors which are responsible for the spread of dengue fever. The unplanned or uncontrolled urbanization, interrupted or inadequate water supply, deficient wastewater management, failure to effective mosquito control measures. So these all are the main factors which are mainly responsible for the spread of dengue virus. Okay, so let us see the pathophysiology of the dengue fever. First, there is a bite of Aedes aegypti mosquito. The virus penetrates into the skin. The virus infects and replicate inside the Langerhans cells, that is immunity of the skin. Then the cells releases the interferons in order to limit the spread of infection. The infected Langerhans cells go to the lymphatic system to make sure that the immune systems are alert. Then it goes into the circulation, which is resulting in viremia, the high of the viruses in the bloodstream that leads into the activation of the immune responses that increases the lymphocytes and decreases the neutrophil counts and the white blood cells, that is WBCs. This leads into the release of pyrogens, which causes the fever and increases the blood pressure into the vessels, and that causes the rashes, and finally it leads into the dengue fever. So, yeah, let us see the clinical signs and symptoms. The clinical signs and symptoms of the dengue fever are mainly classified in three phases. First one is the febrile phase, second one is the critical phase, and the third one is the recovery phase. The febrile phase, which lasts from 1 to 3 days, and the critical phase lasts up to 6 days, whereas the recovery phase, which ends up to which starts from seventh day onwards. Okay, so let's see what happens exactly in the febrile phase. So in the febrile phase, there will be the sudden high fever, which may be of 102 to 104 degrees Celsius. It will be, and then there will be severe myalgia and arthralgia, due to which this particular disease is also known as breakbone fever. As I was explaining with respect to Ayurveda point of view, there will also be the explanation that there will also be the joint pain due to the involvement of Vata dosha, and retroorbital pain, which is nothing but there will be severe pain behind the eyes. As this particular point was also explained by our acharyas in Madhava Nidana, wherein which there will be Nedra Shula, and the petechial rashes are also seen, and the facial flushing and erythema. So these all are the main signs and symptoms which we will see in the early phase of the febrile phase. And in the critical phase, if we won't treat in this particular phase, then it shows the other symptoms, such as there will be severe abdominal pain, mucosal bleeding will also seen, and persistent vomiting, hepatomegaly, which is nothing, hepatomegaly, and rapid drop of platelet count and raised hematocrit values, which will lead into the fluid accumulation, such as the ascites or pleural effusion can also be seen in critical phase if we won't treat properly. And then in the recovery phase, there will be again reabsorption of that extravascular fluid takes place, and gradual normalization of the platelet count and hematocrit will takes place, and then there will be a slight fatigue and weakness as seen in recovery phase. Yeah, let's see the treatment part. The management is relatively simple, inexpensive, and very effective in saving in lives, so long as the correct and timely interventions are given. So, as I already told that it can be preventable and curable. It is diagnosed at a proper time and the proper treatment is given. So, the main pathological abnormality in this particular disease, there is a loss of plasma volume from the vascular compartment. Because of that, there will be increased capillary permeability, right? So the first main motto is to restore that lost plasma volume with the help of our fluid management. Okay, so the early and effective replacement of plasma losses with the fluid and electrolyte solutions will resulting in favorable outcome in most of the cases. So the treatment goes like this. First, we have to monitor the vital parameter, that is hematocrit, as well as the platelet count we have to monitor throughout the disease or throughout the treatment. So the management is depending upon the clinical manifestations and the other circumstances. So the management we can be classified into three groups, that is group A, group B and group C, depending upon the severity of the symptoms. If the symptoms are not very severe and we won't see that much of dehydration in the patient, so we can manage in the OPD base itself, we can send the patient at home. And the group B in hospital management, and group C is which requires the emergency management. So first we have to see the hematocrit value. Okay, then if it is reducing, then we what we have to do is we should go with isotonic solutions of normal saline or ringer lactate with 5 to 7 ml per kg per hour for initial 1 to 2 hours, then 3 to 5 ml per kg per hour for next 2 to 4 hours, then 2 to 3 ml per kg per hour in next hour. Okay, so then again we have to look for the HCT count, and also the we have to the correlate clinically. Okay, so if that HCT or hematocrit value is same, or if it is rising minimally, then again we have to insist that normal saline or the ringer lactate, that is RL, with the 2 to 3 ml per hour for 2 to 4 hours. Then once that HCT value are coming into normal or it getting decreases and the patient shows the improvement, then we can slowly reduces the volume of IV fluids which we are infusing. Okay, so along with the IV fluids, the symptomatic management is also very much necessary. So what Ayurveda says for the management of dengue, let us see. The first line of treatment is Langhana, that is nothing but the fasting or light diet to kindle the Agni, or in order to stimulate the Agni, as in case, as in any type of the fever, it may be dengue or it may be malaria or typhoid, whatever it may be, the digestive fire of the person is definitely hampered in this particular stage. So one need to be on fasting or the light dieting food should be given, otherwise it lead into again indigestion and ama. It may cause the accumulation of the toxicity, or it may even lead into nausea, vomiting sensation. That is why one need to advise for langana, that is fasting, or advised to take light diets. And the second line of treatment is Deepana and Pachana, in order to improve the Agni and also in order to improve the digestion as well as the assimilation of the food, whatever we are going to take. So this is done by using the herbs like Trikatu, Chitraka, in order to digest the etc. Trikatu, Chitraka, etc. Like Agni Tundivati also we can use, Chitraka also we can use. Okay, so there are some other medicines are there. So then Mrudus Vedana is the next line of treatment, like mild sedation in then a sedation in order to relieve the stiffness and pain. Then the last line of treatment is Rasayana therapy, in order to restore the dhatu integrity as well as the immunity. The drugs which can mainly used for Rasayana purpose, like Guduchi, that is Tinospora cardifolia, Amalaki, papaya leaf juice, which is very evidently even used by our allopathic doctors also, in order to improve the platelet counts, and also the tulsi, neem. So these all are the some of the herbal medicines which can be used in order to prevent it. It also act as antipyretics also, especially guduchi and neem, tulsi, etc. It also acts as antipyretic, and it also act as immune boosting medicine also. Some classical formulations such as Sanjeevani Vati, the main ingredient in Sanjeevani Vati is again the guduchi, that is Tinospora cardifolia. Because of its Tikta rasa, it even helps in Shroto Shodhana also, and also act as antipyretic. And then Tribhuwana Kirti rasa, which is herbo mineral medicine, which has both rasaushadis as well as kashtoshadis in it. which act as antipyretic as well as detoxifying, and the Sudarshana Churna, which is the broad spectrum of fever remedy, and the Padmakadi Taila for external application for pain relief, as there is definitely the muscular pain are seen in such a condition. So this kind of external applications will help the person to relieve from pain. And some preventive manage measures, the first and foremost thing is environmental control. As I've already told that the main thing which help which involve in the spread of this dengue is the vector, that is female anopheles mosquito. That mosquito breeds in stagnant water, right? So the main purpose or main motto in the preventive measure, the first and foremost thing is to eliminate the stagnant water. So for that, what we have to do is weekly the cleaning of containers like flower pots, buckets, coolers, and bright bags, etc. And then cover the water storages, like use of tight lids or mesh screens can also be used in order to control the entry of mosquito into that water container. And also cleans and drains and gutters, which prevent the water accumulation. And personal, this is related with the environment. Then for personal protection, what we can do is use of mosquito repellents, okay, and wear the protective clothing as much as possible in the the tropical and subtropical areas, where in which there are more risky areas are there. So in such areas, one need to use of cloths like long sleeves, pants, and socks instead of using the sleeveless dresses and all, especially during early morning and dusk, because the Aedes aegypti mosquito is early morning. It actives mainly in early morning. That is why this thing. And then sleep under the mosquito net, especially in the areas without screened windows or air conditioning, right? And then home safeguards, what we can do in home: install the window and door screens, use the indoor repellents like coil vaporizers or plug-in devices, keep the doors and windows closed during the peak mosquito hours. And let us see some Ayurveda preventive measures also. The first thing is, in order to boost our immunity, so prevention is better than cure. So in the preventive measure, the first and foremost thing which comes is boosting the immunity, that is Ojas Vardhana. Oja can be correlated with the Bala, that is the immunity. So Vardhana is nothing but something which is increasing. So boosting. So boosting the immunity, such as with Gudchi, that is Tinospora cardifolia, which act as the rasayana and also enhances the immunity and pacifies the three dosha. The second one is Amalaki, which is rich in vitamin C and also supports the Rakta Dhatu and also helps in balancing the Pitta dosha, as Pitta and Rakta are mainly involved in this particular disease. And Tulsi, which acts as the antiviral, adaptogenic, and then mosquito repellent properties also it has in it. And Ashwagandha, so which is widely used, which helps in strengthening the ojas and reduces the stress and induces the immune also suppressants. And you can also prepare a daily kashayas with the help of guduchi, tulsi, amalaki, shunti, and you can for the preventive measures also we can use it. So the second thing is with the dietary guidelines is how with our ahara paddhati we can control this particular thing. It is with by using the favoring the light and easily digestible food like lagu ahara in order to maintain the agni, because in this particular disease the agni is mainly hampered. And also avoid the stale, heavy, and excessive oily food that aggravate the kapha as well as the pitta, and including the bitter and astringent tastes such as tikta, kashaya rasas in order to support the detoxification. And how can our lifestyle and environmental hygiene can help in preventing the dengue is by keeping our surroundings clean and dry to prevent the mosquito breeding. And second thing, use the Ayurveda fumigations like Dhupana Kalpas with the herbs like Gugulu, Vacha, Haridra, and even the Nimba. So such drugs will helps in controlling the mosquitoes, okay. And then wear the protective clothing and apply the herbal oils like Taila Abhyanga to exposed skin. to the exposed skin. And the sum of Ayurveda mosquito-repellent herbs like neem oil apply externally. Its bitter property deters the mosquito. And the lemon grasses, which is used in Ayurveda sprays and diffusers. And also the camphors, that is Kapura, burns in room in order to purify the air and also repel the insects. So these all are some of the Ayurvedic measurements which helps in preventive aspects also as well as the curative aspects also. Okay, so the second vector-borne disease, that is malaria, which is also caused by again one of the mosquito. Okay, that is female Anopheles mosquito. Then malaria is a mosquito-borne febrile disease. It is also a febrile disease which is caused by the malarial parasites. Okay, so the humans are infected with the Plasmodium protozoa when bitten by a vector called female Anopheles mosquito. It is mainly affects the liver as well as the red blood cells are mainly affected in this particular disease. So why we need to study again? Because malaria remains the world's most devastating human parasitic infection. A high disease burden again it is. The malaria affects over 200 million people annually. Vulnerable populations, the children's under 5 age of and the pregnant women are most at the risk and making it as a major cause for preventable deaths. Okay, so then by looking at its epidemiology, India accounts for 1.4% of the global malarial cases and 0.9% of the global malarial death, with 52% of all the malarial deaths outside the sub-Saharan African occurring here. So it is also carrying the 46% of the global Plasmodium vivax burden, making it a key country in a global malaria elimination effort. So let us see what all are the causative factors for the causative factors for causing the malaria. Mainly, it is as it is a protozoal infection. Mainly, there are four types of protozoa such as Plasmodium falciparum, Plasmodium vivax, Plasmodium ovule, and the last one is Plasmodium malaria. So the most commonly humans are affected by Plasmodium falciparum and Plasmodium vivax. Okay, so let us see its pathophysiology. So, whenever the mosquito bites an infected person, what happens is whatever the gametocytes which are released from the liver and the RBC cells, it enters into the saliva of the mosquito, and then there the asexual development of the asexual development will takes place, so that microgametes will develop as a macrogametes and then the zygote, and then in the midgut it again becomes like a oocyte, and then that bursting of that oocyte, so then that releases that sporozoites, so that sporozoites are present in the salivary glands of the mosquito, right? So whenever that infected mosquito bites in a normal person, so that whatever the sporozoites were there in the salivary glands of the mosquito, it enters the person's it enters the person's bloodstream, and then it takes an entry into the hepatic cells, that is liver, through via the bloodstream. In the liver, what happens is the multiplications of the sporozoites will takes place. Okay, so then it takes up the maturation, becomes it starts its sexual developments will takes place in the host, that is definitive host is a human being here, so it takes up its all the sexual development there. Okay, so then multiply inside the hepatic cell, and then it takes entry into the RBC cells. There again in the RBC cells, it's multiplies and burst opens from the RBC cells, and again it infects the new RBC cells, and again this cycles will go on continuing. Okay, so that is why the main organ which is involved in this particular disease is the liver and the RBC cells. So the incubation period is 8 to 10 days. The extensive incubation period is 8 to 10 days. That is the incubation period which is taking place in the mosquito, that is 8 to 10 days. The incubation period in the human being is hardly of 4 to 6 days. Here, the intermittent host is a man and definitive host is a mosquito. Okay, so then let us see the signs and symptoms of this particular disease. it can be divided into three stages, like same in case of dengue. It was the critical phase, febrile phase, critical phase, and recovery phase. In the same way, in malaria, it is again divided into cold stage and hot stage and the sweating stage. So let's see what happens in the cold stage. The duration of the cold stage is 15 to 60 minutes. Okay, so let's see what all of the symptoms are experienced by the person in this particular stage. There will be an intense chills and the shivering. This chills and shivering is because of sudden release of the merozoites and the malarial toxins into the bloodstream, due to which person feels an intense chills and the shiverings. And second thing is feeling of extremely cold despite the high body temperature, and the pale skin and goosebumps are seen in this cold stage. Let's see what happens in the hot stage. So the duration of this hot stage is 2 to 6 hours. Okay, so the symptoms which are seen in the hot stages are the high fever, which is up to 41 degrees Celsius or 106 degree Fahrenheit can be seen, and flushed skin and dry skin are also seen, and hot to touch even. And then there is headache, nausea, and vomiting sensations. So the immune system responds to the infections by causing the a spike in a body temperature. So, what happens in the sweating stage? So, the duration of the sweating stage is 2 to 4 hours. The symptoms, such as profuse sweating, rapid drop in the temperature, feeling exhausted but relieved. The fever breaks and the body tries to cool down rapidly. So, what happens? This stages once the cool stage, the hot stage, and again the sweating stage, and person feels as if he relieved from the fever, and person feels as if like he's okay. Then again it's relapse, and the cycles of the phases of that clinical phases will again continues again from cold stage to hot stage and hot stage to then sweating stage. This will go on continuing unless and until the proper treatment is given. Okay, so let us see what all are the treatment modalities are administered. So the medicine types, such as atrimicin based, that is combination therapies, ACTs, that is artemether and lumefantrine, can be given, which is most preferred for most Plasmodium falciparum infection, which is due to the drug resistance. Okay, and most commonly used is chloroquine phosphate, that is chloroquine, effective only in a regions where the parasites are still sensitive to it. Okay, so nowadays most of the parasites are sensitive to chloroquine. If even after intaking of the giving the chloroquine, the symptoms are not the coming into the control, then the second line of treatment we have to use. So the other anti-malarial drugs, such as atoquinone, and then malarion quinone sulfate with doxycycline. Okay, so then these all are the some of the other anti-malarial drug of choice which are available with us. Okay, so let us see what all are the prevention. Again, based on the other symptoms, the symptomatic along with this medicine or along with this drug, based on the symptoms, the symptomatic treatment can be given. Okay, so let us see what all are the preventive measures can be taken in this particular disease. So the preventive measures seems like similar with respect to dengue as well as malaria, because both are mainly spread due to the mosquito, which is a vector again here. So we can use the same preventive measures which are used in dengue, and the same thing we can use here also, such as use like insectable treated bed nets, especially while sleeping. Avoid the apply the mosquito repellents. Okay, and then wear the protective clothing with the long sleeves, pants, and socks in the evening. And install the screen on windows, doors, or use of air conditioning. So then again, the environmental control, like eliminating the stagnating water around the homes, like flower pots, gutter, and puddle, etc., and keep the our surrounding clean in order to prevent the mosquito breeding, because mosquito is a main culprit to spread from one person to other person here. Okay, so use the indoor and residual spraying with the approved insecticides, and then chemoprophylaxis treatment, such as the preventive medicines. Take an anti-malarial drug if you are traveling to the endemic areas where like risky areas, such as doxycycline, mefloquinone, premiquinone for a liver stage of parasites like Plasmodium vivax. Always consult a healthcare providers for the right medications as well as the dosage. So the dose of a medicine is depending upon the weight of a person as well as the severity of the symptoms. So there are some vaccinations which are invented specially for malarial prevention, such as the RTCS AS01 Mosquirix vaccine, which is approved for children in high transmissions area. Okay, so yeah, so this is what all about the preventive as well as the curative measures for both dengue as well as the malaria, which are the main two vector-borne disorders. So our even our government is also trying to eliminate it from the country under vector-borne disease control program. Our government is conducting so many programs in order to prevent it and also to eliminate it.
Thank you. Thank you very much, Dr. Rekha. Thank you.
Thank you.
Excellent. No word about except this. Excellent. You have covered, your lecture was excellent in flow, content is excellent, and you have covered almost all aspects of the malaria and dengue. Great. Please do join every day. We
Yes,
will
sir.
and communicate my regards to Dr. Swagat.
Yes, sir, sure. And I
Thank
also extend my heartfelt thanks to whole team for giving me an opportunity with a prestigious platform to present myself and also to share my knowledge. So
This is your
thank you for
platform.
the
Please consider
opportunity.
this platform as yours.
Yes, sir. Thank you.
Welcome. So now I would like to invite Dr. Tejendra. He is also very dynamic speaker, young dynamic assistant professor of Swasthya in Bijnor. Dr. Tejendra. Welcome.
Namaskar, a very good evening to respected teachers, all the dignitaries, and all the speakers. My name is Dr. Tejendra Singh, Assistant Professor, Department of Swasthya, Krishna Ayurvedic College, there, Bijnor. Today I'm presenting my topic on dengue and malaria, prevent and cure. Um, Dr. Rekha Madam already described everything in detail, so I will go in briefly. Dengue and malaria, vector-borne diseases. Vectors can transmit diseases among different living beings like mice, rats, monkeys, birds, dogs, and humans. Treatment of vector-borne disease is difficult, and the prevention is essentially necessitates the elimination of the vector. So always prevention is better than cure. So these are the vector-borne diseases like a chikungunya, kala-azar, dengue, and malaria. And dengue and malaria are the commonest. Dengue and malaria, these are the two main vector-borne diseases. And what are the differences? Like the causes of dengue fever, is like from the bite of infected Aedes mosquito. And about malaria, it causes by the bite of female Anopheles mosquito. Incubation period of dengue symptoms appear 4 to 5 days after being bitten. And about malaria, like 10 to 15 days after being bitten. Symptoms of dengue fever like headache, fever, pain behind the eyes, nausea, vomiting, swollen glands, joint, muscle pains, and rashes. IRES is also common, more common in dengue. And in malaria, headache, fever like dengue, nausea, vomiting, joints pain, and muscle pain will be there. What are the vectors? Vectors are living organisms that can transmit infectious disease between humans or animals to humans. Vector-borne diseases are the diseases caused by disease vectors, often found in tropical regions where insects prevail and access to drinking water and sanitation is not safe. And about now, vector-borne disease program. Launched in 2003 for NAMP and FCP and Kala-Azar control program, Japanese bee encephalitis and dengue DHF have also been included in this program. Directorate of NAMP is the nodal agency for prevention and control of major vector-borne diseases. National Vector-Borne Diseases Control Program (NVBD-CP), launched in 2003 by convergence of three ongoing programs on malaria, viruses, and Kala-Azar, and inclusion of Japanese encephalitis and dengue. In 2007, chikungunya fever added to this program due to re-emergence of the disease in 2006. This program is now runs under the umbrella of National Health Mission (NHM). Milestones in the field of malaria. The first is National Malaria Control Program 1953, National Malaria Eradication Program 1958, Urban Malaria Scheme 1971, Modified Plan of Operation 77, Malaria Action Program 1995, Enhanced Malaria Control Project 1997, National Anti-Malaria Program 99, NVBDCP 2002, Intensified Malaria Control Project launched in 2005, and World Bank supported National Malaria Control Project in 2008. The central government said that traditional medicines are being developed for prevention and management of vector-borne disease. Preclinical studies of a new drug for dengue, that is IUSPJ7, have been completed, and new drugs for other diseases like malaria, filariasis, and Kala-Azar are under development. CCRS has formulated IUS64, as we know, a polyherbal anti-malarial drug, which is common nowadays. It has recently developed, CCR has already developed a new Ayurvedic drug for dengue, that is IUSPJ7. Preclinical studies for IUSPJ7 have been completed. So we already have two research-based herbal combination drugs patented by CCRS. One is IUS64 for malaria and another is IUSPJ7 for dengue. This is about data. Dengue causes in 6 years. Dengue cases in 6 years. About like it's increasing every year. 2018, 19, 20, 21, 22, and 23. It's like a huge spike in 2023. Dengue cases in the country since 2018. So it's about like a state-wise data. So most of the cases in UP and then Punjab, also in Maharashtra and Delhi states. This is about the deaths causing due to dengue. So in 2024, cases are of course more, but deaths happening less. That's a good sign, like due to government's program, जो भी लोग precautions ले रहे हैं, एक awareness के through, गवर्नमेंट के प्रोग्राम्स के थ्रू और लोकल जो अवेयरनेस हो रही है एनजीओ के थ्रू, एंड खुद भी जो लोग एडवर्टाइजमेंट के थ्रू देख रहे हैं कि हमें क्या प्रिवेंशन करना है, कैसे हमें एक साफ सफाई रखनी है, तो वो चीजें केसेस तो आ रहे हैं, बट लाइक डेथ्स उतनी नहीं हो रही जैसे पहले, एज हम डाटा देख पा रहे हैं जैसे पहले होती थी. इट्स अ बिग थिंग, लाइक इट्स अ गुड थिंग कि लोग अवेयर हो रहे हैं, लोगों को पता है कि हाँ रेनी सीजन आ रहा है तो हमें कैसे करना है, कैसे हाइजीन मेंटेन करनी है, कैसे हमें मॉस्किटो बाइट से बचना है, अगर मॉस्किटो कहीं पे है तो कैसे हमें उसको प्रिवेंट करना है और को इन्फेक्ट होने से. About another case, this is from the one of paper, dengue, malaria, and chikungunya. Dengue fever is an infectious carried by the Aedes mosquito. DN1, DN2, 3, and 4 are the four main viruses. Malaria is life-threatening infectious disease transmitted to humans by infected female Aedes mosquito, as we know. So these are about the signs, like the pain in the eye is the normal, severe headache, muscles pain, nausea, swollen glands, vomiting, rashes. So whenever someone is feeling this kind of things, तो उनको at least अपने nearby hospital में जाना चाहिए. इनको ignore नहीं करना चाहिए अगर pain हो रहा है, vomiting वाली feeling आ रही है. So another is data by WHO. Over the last 2 decades, malaria-affected countries have achieved remarkable success, but the fight is not over. हमें सक्सेस मिल रही है एज कम्पेयर टू प्रीवियस ईयर्स, बट अभी भी इसमें और काम करने की जरूरत है. 7.6 मिलियन lives saved globally since 2000, 94% of them in Africa. That's a big thing. इस बार WHO के जो प्रोग्राम्स चल रहे हैं, बहुत सारे एनजीओ उसमें अपना पार्टिसिपेशन दे रहे हैं, लोगों की अवेयरनेस, तो इट्स अ बिग थिंग कि लोग अवेयर हो रहे हैं और ये धीरे धीरे रेशियो कम आ रहा है. Worldwide in 2020, there was an estimate 241 million malaria cases was there all over the world, and 6,27,000 deaths happened due to malaria. This was introduced by the World Malaria Report 2021. ये WHO ने एक रिपोर्ट जनरेट की थी, पब्लिश की थी. उसका ये डाटा है कि सिर्फ मलेरिया से इतने केसेस थे और इतनी डेथ हुई. ये भी WHO का डाटा है. नियरली हाफ द ग्लोबल पॉपुलेशन इज एट रिस्क. तो इसके लिए हमें प्रिवेंशन पार्ट पे ही ध्यान देना पड़ेगा कि हाउ वी कैन प्रिवेंट डेंगू एंड मलेरिया एंड अदर टाइप ऑफ this kind of vector-borne diseases. Rainy season is the main thing for the main season. Rainy season raises risk of vector-borne diseases, and dengue cases often see a peak between July and November. As many parts of the country are receiving heavy rains, the month of July, August are already seen a surge in the cases of this deadly mosquito-borne disease. जैसे कि हम लोग देख रहे हैं कि आजकल केसेस आ रहे हैं न्यूज़पेपर में, हमारे नियर एरियाज में सुनने को मिल रहा है, उसको डेंगू हो गया, उसको मलेरिया हो गया. Considering Ayurveda emphasizes on prevention and holistic wellness, it has many herbs that improve immunity and aid in dosha balance to prevent against dengue and malaria. If you will talk about Ayurveda viewpoint, according to Ayurveda, dengue fever may be understood as a variety of Visamajwara Dandakjwara, where the fluctuation in temperature is the characteristic feature. It shows the predominance of Vata and Pitta aggravation and the methods that involve curbing these entities. Thus, it is vital to prevent this ever-spreading communicable disease by using the authentic methods mentioned in Ayurveda. How Ayurveda and natural treatments can help prevent dengue and malaria. The first is wonder herb is guduchi. The common giloy or Tinospora cordifolia is one perfect Ayurvedic herb that helps to reduce both vata and pitta, aggravated vata and pitta, positive factors of dengue fever. Guduchi helps with both the prevention and treatment of dengue affected individuals. जैसा कि हम सबको पता है कि लोग जनरली खुद से भी गिलोय का काढ़ा और आजकल हर किसी के आसपास उसकी बेल इजीली अवेलेबल रहती है. How to have guduchi? During the severe monsoon season, guduchi infused water may be consumed as a preventive method. The same can also help to reduce the symptom during an episode of dengue fever. In Kerala, guduchi is known as amrut because of its rejuvenating properties. In Ayurveda, it's like have mentioned a lot of benefits. Ayurveda has various formulations such as Amrutarest and Amrutaram Kasayam, Amrutaram Kwat that are infused with the power of guduchi. इसलिए बोला गया कि whenever this kind of fever की सबसे पहले इस टाइप की कसायम हम इसका गुड़ीची का काढ़ा, गुड़ीची का सत्व, ये चीजें देनी चाहिए. Another herb is Kalmega. Andrographis paniculata is one herb in particular that helps balance all the three dosas. It has an astringent metabolic end effect with hot proteins that reduces the prevalence of Vata and Pitta in particular. It also can enhance the factor of OJS or the quantum of immunity, preventing the diseases. Now, what are the remedies to prevent dengue? The first one is fumigation. However, fumigation can be done using neem, Azadirachta indica, Kalmega, Andrographis paniculata, Haridra, Curcuma longa, and Ushir, Vetiver jejunites to prevent during dengue. These helps to create a perfectly neutral environment that resists the virus from propagation and repels mosquito. The indirect inhalation of these fumes is also a passive method of prevention as it triggers immunity. So we can do fumigation very oftenly around our home, around our like living areas, around our community, and we can also aware the people about the fumigation. Of course, mosquito will be there, but how we can prevent that thing, the spreading of those vector-borne diseases. Another thing is Sadang Paniya. In this Ayurvedic treatment protocol for fever, the ancient text Sahasra Yugam advocates the use of Sadang Pani or Pathya Sadangam, a combination of 7 herbs. First one is Pathya, terminally Chabula. Another is Aksha, terminally Balavica. Third is Amla, Amlica officinalis. Kalmega, Andrographis paniculata, turmeric curcuma longa, and neem azadirachta indica, and guduchi lastly, Tinospora cordifolia. So we can add 30 ml Pathya Sadangam Kwat in 200 ml boiled water and drink this from time to time to relieve in fever. सो ये बहुत अच्छा इफेक्टिव है अगर सिर्फ सड़ंग पानी का भी यूज किया जाए एंड डेंगू एंड चिकन मलेरिया फीवर, तो ये इनिशियल कंडीशन में बहुत इफेक्टिव है इंस्टेड ऑफ टेकिंग पैरास्टामोल एंड अदर काइंड ऑफ मॉडर्न मेडिसिन. Application of cooling paste. A simple paste made with sandalwood and rose water can be used to apply topically for temporary relief from dengue fever rashes. अगर रैसेस ज्यादा हो रहे हैं तो एक कूलिंग पर्पस के लिए हर्बल वे में हम ये यूज कर सकते हैं. Although it is advised to consider the advice from Ayurvedic healthcare practitioners and before considering this as a treatment method. ये तो जस्ट लाइक एक रेमेडीज हैं इनिशियली लोकली, बट अगर केसेस ज्यादा एडवांस हो गए, ज्यादा इश्यूज हो रहे हैं, तो नियर बाय आयुर्वेद प्रैक्टिशनर आपको रिकमेंड कर सकते हैं. One should take precautions such as hygienic water storage techniques and correct disposal of solid waste, consuming boiled water, putting a cover on the containers, removing old water from ports and balconies to prevent mosquito breeding, sleeping with a mosquito net. Tips for quick recovery. The best advice for patients who are recovering from dengue to take ample rest. Rest बहुत जरूरी है कि अगर डेंगू डायग्नोस्ट हुआ है, मलेरिया डायग्नोस्ट हुआ है, तो रेस्ट बहुत जरूरी है. Diet has a big role to play during dengue recovery. लघु आहार, सुपाच्य आहार, अग्नि के according. That's the main thing. People are often advised to eat small and frequent meals. Fruit increased, have coconut water, add a lot of fruits in your diet. Avoid spicy and fried food while you are recovering, and multivitamin supplements to boost your energy levels. These things help to strengthen immune system and stamina. And it's about protect yourself from mosquito bites. Mosquitoes spread chikungunya, dengue, and Zika, these kind of viruses. So daytime is the most dangerous. Use insect repellent, wear protective clothes, possibly full sleeves clothes. And when we go, we are taking germs or vectors with us. So be careful. And another picture is about unity can protect our community from vector-borne diseases. So we have to like have these things with us, like mosquito net, full sleeve shirts, pants, and some other things like if like just like a few things are there. बच्चों के लिए ओडोमॉस and something लगाने के लिए अगर वो बाहर जा रहे हैं, we can't avoid all the things कि बाहर जाना अलाउ ना कर पाए, तो वो we can apply locally those things. Fumigation घर के nearby करें and be proactive. Another important thing is be proactive, otherwise mosquito will make you captive. So prevention का इसमें importance बताई गई है कि हमें पहले एक्टिव होना पड़ेगा, otherwise issues होने में फिर medications on further health issues रहते हैं. So pour water, any standing water उसको हटाइए. Choose lighter color clothes, full sleeve clothes. Be careful during peak biting hours like dawn and dusk. दोनों टाइम पे, मॉर्निंग इवनिंग टाइम पे. कीप मॉस्किटोज आउटसाइड, यूज विंडोज विद स्क्रीन्स, यूज एन इफेक्टिव रिपेलेंट. एंड लास्टली वी हैव टू फाइट द बाइट. ऑलरेडी हमने काफी वर्ल्ड वाइड काफी वेक्टर बॉर्न डिजीज में सक्सेसफुल ली है, और WHO NGO के थ्रू आयुर्वेदा कम्युनिटी, आयुष डिपार्टमेंट, बहुत सारे लोग जो अभी ये वेबिनार सीरीज भी चल रही है, कहीं ना कहीं इसके थ्रू भी, यूट्यूब के थ्रू भी लोगों को अवेयरनेस मिल रही है. तो हर किसी का इसमें बहुत बड़ा रोल है. लास्टली आई वुड लाइक टू से थैंक यू सो मच डॉक्टर पवन शर्मा सर, गिविंग मी सच a great platform. Thank you so much, sir.
Thank you, Dr. Tejendra. Means I generally say in my webinars, our Ayurvedic experts are unique. No doubt you both are unique, because nobody has copyrighted or nobody has copied anybody's presentation. And unique concept by heart are included in presentation. Really great. Thank you, Dr. Tejendra. We are meeting again tomorrow on geriatrics. Thank you very much. Now I would like to request Dr. Sakat Kumar Basuji. Sakatji, welcome. Dr. Sakat Kumar Basu. हरिओम सकत जी. नहीं, आप तो जुड़े हुए हैं, आपका तो जुड़े हुए. मैं भेजता हूँ, मैं भेजता, अभी आप जुड़े। So I would like to welcome Dr. Suparna Sanyal Mukherjee Madam, who is kind enough to share her video to us on the.
Good evening to all dignitaries over here. Thank you very much for giving me such an opportunity to say something on this auspicious platform on the dengue fever. This dengue, and basically this dengue mosquito is causes for this dengue fever. The mosquito is known as the Aedes aegypti. This Aedes aegypti, also known as the Egypt mosquito, and which is the causes for this dengue. And this mosquito, especially the kingdom is Animalia, phylum is Arthropoda, class is Insecta, order Dipteria, family Culicicide, and this genus Aedes, species is Aegypti. And this mosquito is found in this especially Indian subcontinent and the West Bengal area, which has been found in the after the summer season. When the rainy season is to start, this mosquito is also started they're biting to the patient, and this virus is also spreading all over the West Bengal and other parts of the world. So it has been observed that the 4 to 7 millimeter long this mosquito, and this mosquito cause for the high fever, and especially the patient will suffer from this high fever and vomiting tendency, the platelets deterioration, all are happens. And host is they include domesticated horses. These horses, they are basically the wild horses. This mosquito has been generated and it is distributed all over the world, and it is found it out this basically in Africa, and this this Aedes mosquito is originated from this Africa subcontinent, and it is also spreading over all over the world. And this is very important part of this vector-borne diseases, like it has happened in the how to spread and the population control effect, the insecticides and genetic modification of the Aedes mosquito generally rectified and modified to the suppress its own species, and an approach similar to sterile insect technique. And this is the causes for this dengue fever, and dengue is very dangerous. The patient can be lost into died in this dengue. So dengue is also generating this Asian subcontinent, especially the Indian subcontinent, and the West Bengal also people are suffering from this dengue, and there is a very dangerous situation that people used to suffer. And another purpose method of this dengue control measures should be taken by the government level, NGOs level, and the other the people initiative is needed. Community health development should be incorporated, and the consisting in using radiation to sterilize the male larva, so that when they mate to the females, so there should not be any dangerous situation may form. At the same time, the especially the mosquito net should be used. There should not be any chances for this mosquito biting, and the people should take care of themselves. And there is a using of CRISPR, that is which is very genome therapy, and especially engineering genome therapy of Aedes mosquito is also incorporated right at this moment for the protection of this sterilization of this male mosquito. Especially the male mosquito used to bite, and it's spread through the male mosquito. Like the Anopheles, there is the female mosquito is the causes, but here it is the male mosquito is the causes. And infection especially has happened the high fever, the headache, then the vomiting tendency they are suffering from. And this is very dangerous situation, and platelets level used to deteriorate. That's why the blood donation is needed. Without taking blood, people cannot survive, and this is the system where we have to find it out why people are suffering from, and we have to take oath how to protect Aedes mosquito sensation and Aedes mosquito biting, and how we can protect our people throughout the world, and especially those who are living in the geographical territorial niche. And we have to stay safe, and we have to protect ourselves, and we have to take the same measure for this mosquito biting technique. Thank you very much. Thanks for giving me such an opportunity. Thanks a lot.
Thank you very much, डॉक्टर। मैं अब डॉक्टर शैकत बसु जी को सादर आमंत्रित करता हूं। आई वुड लाइक टू इनवाइट डॉक्टर शैकत बसु जी।
Thank you, Sharma ji. Thank you so much for including me in the part in this webinar. It's a pleasure to be a part of this platform, and I think we had a very productive session in which all the speakers have very nicely described and illustrated the details of the malaria and dengue cycle, as well as the possible treatments both in AYUSH platform as well as in other alternative medicinal platforms. So I'll just summarize the session based on the information I collected, and also my suggestions, saying that malaria and dengue fever are both mosquito-borne diseases with overlapping symptoms, but they require different management approaches. As discussed, malaria is treated with anti-malarial medications, while dengue fever management focuses on supportive care, including hydration and pain relief, with hospitalization needed for severe cases, in addition to the AYUSH treatment that we have so much extensively discussed in the session. Both diseases can be prevented by reducing mosquito breeding sites and avoiding mosquito bites. This is one thing that the municipality, corporation, and the gram panchayats across the country needs to come together in making people aware and work towards on a common platform so that we are able to reduce the mosquito breeding sites. This is one thing that is lacking both in the awareness of the public as well as the government agencies, where we have multiple sites of stagnant water, dirty water in and around our human habitation, which is causing and serving as the breeding ground. This could not just be overcome by the government. There needs to be a support of the public also, and by a public-private association, I only think that we could deal with these challenges. The basics of the malaria management, summarizing, is diagnosis is very important. Parasite-based diagnostic testing, microscopy or rapid diagnostic test is now extremely crucial for confirming suspected tests. Anti-malarial medications, mainstay of treatment with specific drug chosen based on the infecting plasmodium species and local drug resistance patterns, together with the excellent AYUSH medication platforms that we discussed on this platform, is extremely helpful. Reducing mosquito breeding sites using insecticide-treated nets and chemoprophylaxis are key prevention strategies, as all the other presenters have mentioned. Vaccination for malaria is now available. The RTS and the AS01 malaria vaccine is now recommended for children in regions with moderate to high malaria transmission. Dengue fever management, as we summarize, includes early diagnosis is very important, as all the speakers have highlighted, and can be aided by hematological parameters like MCH and eosinophil count. Very easy to detect, but needs proper encounters and service for the health centers to identify them quickly and provide the report so the doctors can take necessary steps. Supportive care in the primary approach. This includes maintaining adequate hydration, pain relief with acetaminophen, particularly in case of allopathic medication. And we have already discussed in very beautiful terms the AYUSH medication that we need, the herbs that are extremely good parts, the decoctions that we have talked about, and the mixture of herbs in the preparation is an excellent discussion that we have today. Controlling mosquito pollution by eliminating breeding sites and using mosquito repellents and mosquito nets should be mandatory in areas which are endemic to dengue. Sometimes just by these preventive measures that we follow, we are able to reduce the level of infection and the infectivity among the people. Avoidance over-the-counter pain relievers like aspirin and NSAIDs should be avoided, which has become a very common practices. I would rather suggest all our listeners on this platform and viewers that it adds to the risk of various complications. So it is better to avoid these over-the-counter drugs. If one goes for the AYUSH medication and stuff, it will be definitely beneficial for them, but they need to follow the direction of our trained Ayurvedic practitioners. key differences and similarities. This is one important thing that I collected from all the presentation, and I'd like to highlight is that how to differentiate between these two diseases. Malaria is caused by a parasite, while dengue fever is caused by a virus. Both are transmitted by mosquitoes, but they are different species of mosquitoes. Both have a common symptoms such as fever, headache, and body aches, but dengue can also rash and severe bleeding complications, which must be taken care of while during the process of diagnosis. Malaria requires specific antimalarial drugs, while dengue requires supportive care, but both can be very well treated with the today on this present day by the help of the AYUSH medications that we have discussed. Both can be prevented by reducing mosquito breeding and avoiding bites, as has been extensively highlighted by all the speakers. So in summary, I would like to mention that while both malaria and dengue fever are mosquito-borne illnesses, their management differs significantly. Malaria requires specific medications, while dengue fever relies on supportive care. Prevention strategies for both diseases involve controlling mosquito populations, and as well as avoiding mosquito bites. Now, those two steps seems very simple, but it is quite unfortunate that we are unable to take care of this as a result of, I believe, that education and awareness and sensitivity among the general public. Unless we understand and appreciate that we need to reduce the mosquito breeding sites, the repeated cycles of malaria and dengue fever that has been endemic to these parts of India, and particularly on monsoon-rich areas, particularly on the hot, damp parts of the Indian, and it has spread across the country from Kashmir to Kanyakumari and Kutch to Manipur. It is quite important that we take significant step in reducing mosquito breeding sites and take active steps in mosquito control. Today, biological controls of mosquitoes and other advanced technologies are available. We haven't been able to successfully reduce the breeding site by following cultural methods, but the biotechnological and biological methods should be explored. Singapore has recently, or Hawaii in the United States, they have been recently exploring releasing genetically modified mosquito males, which could produce with females, and then they will produce sterile individuals that are not being able to reproduce anymore. This has been various steps that has been taken to reduce malaria in many smaller areas of the endemic malaria centers, such as Hawaii Islands, particularly in Singapore and other African countries. But extensive steps and research and survey needs to be done to identify important malaria and dengue endemic areas, so that we know prepare a proper endemic maps for these diseases for our country, so that we can well identify and make people aware, particularly in these regions, that they are vulnerable to these diseases and the steps they need to prevent mosquito bites. With this, I conclude my presentation, Dr. Sharma. Thank you so much. It has been a wonderful discussion session, particularly with respect to the AYUSH platform, as many of the treatments that has been discussed by our previous speakers will definitely benefit those who are suffering from malaria and dengue treatments, and will help them cure within a time. With this, I can say good night to you all, and thank you once again for including me in this presentation. Thank you. Thank you, Dr. Sharma.
Thank you, Dr. Shakat. Thank you very much. Excellent webinar on dengue and malaria today. Tomorrow we are conducting webinar on tubal blockage and geriatric, AYUSH for geriatric care. Thank you very much. आदरणीय सीपी शर्मा सर कंफर्टेबल हैं क्या? आदरणीय सीपी शर्मा सर तक मेरी आवाज जा रही है? बिना वीडियो के भी चलेगा सर? हरिओम. I hope late night is there. So thank you very much, Dr. Tejendra.